Hello, everybody. Thanks for joining us for today's presentation. I'm Bill Bush, one of the advisors here at Horizon Financial Group. And over the next 45 minutes or so, we're going to talk about some of the things you need to know about healthcare when planning your retirement. Now, we're going to cover a lot of information, but if nothing else, I hope you come away from this presentation understanding three key points. So the first key point is that if you do not enroll in Medicare on time, you will pay a monthly penalty. A lot of baby boomers don't know if or when they are supposed to enroll in Medicare, but there are very clear rules about when you have to sign up. And if you don't sign up within a specified window, you will be assessed a monthly penalty that you'll have to pay for the rest of your life. And then key point number two. So the second key point is that if you do not get the right private insurance to go with Medicare, you may pay too much in premiums and out-of-pocket costs. Now, the fact that you might even need private insurance to go with Medicare is certainly a surprise to many people. Some people think Medicare covers everything, but it doesn't. So in order to have prescription drug coverage and coverage for other out-of-pocket expenses, you need to have private insurance, and we're going to show you how that works. And then here's key point number three. The third point is that if you do not plan for higher healthcare costs in retirement, you could run out of money or not be able to get the care that you need. So people are usually happy to go on to Medicare when they turn 65 because it provides some relief against high health insurance premiums, but you must be prepared to factor higher future healthcare costs into your retirement budget. And the best time to do that is now. And you'll see what I mean a little later coming up in the program. So we're going to start off with the presentation today, going to be divided in three parts. In part one, we're going to talk about Medicare. What is it? Who needs to enroll in Medicare and when? And how do you even enroll in Medicare? Second part of our agenda. In part two, we're going to be discussing the private insurance that goes along with Medicare. To understand the public-private partnership that is Medicare, we'll be talking about how much Medicare costs, what it covers, and more importantly, what it doesn't cover, and how private insurance integrates with Medicare. And in the third part, we'll talk about how to plan for higher healthcare costs in retirement. And there are two reasons why our healthcare expenses are going to be higher in the future. And the first reason is simply inflation, the rising cost of goods and services. And the other is the increased need for healthcare services as we get older. Now, one expense that needs to be planned for is long-term care. Now, some of you may have had experience, maybe with a parent or a relative needing help with activities of daily living, maybe such as bathing or dressing, or maybe even just keeping up with housework and preparing meals. Many people are surprised to find out that the costs of these services are not covered by Medicare. Okay, so let's start this session by talking about Medicare enrollment, part one. Who pays for healthcare in the United States? Well, if you're under 65, your health insurance is usually work-based. So we're looking on the left-hand side of the slide here. If you're still working, your employer probably provides health insurance. If you're retired, you may have a retiree plan, or maybe you recently left your job and you have extended your employer coverage at your own expense. That's called COBRA. Or maybe you've even purchased your own individual health insurance policy. But after age 65, Medicare generally pays first. And that is, our health insurance system is set up so that once a person becomes eligible for Medicare at 65, most private insurance becomes secondary to Medicare. So when you incur a healthcare expense, the bill is submitted first to Medicare. After Medicare pays what it's going to pay, any other insurance you have may pay some or all of the rest. The only exception is employer group plans that cover 20 or more employees. So if you're still working and covered by such a plan, or if you're covered as a spouse under such a plan, your employer plan will pay first in that scenario. So this has implications for enrollment, which we're going to see in a minute. So what this means is that unless you are covered by an employer group plan that covers 20 or more employees, you must enroll in Medicare when you turn 65. What if you don't enroll in Medicare on time? Well, the consequences are actually pretty dire. First, you'll be charged a late enrollment penalty. And the longer you go without enrolling, the higher that penalty will be, and it will actually continue for the rest of your life. And the second consequence is that your healthcare expenses may not be covered by insurance. As I mentioned, Medicare is the primary payer in most circumstances. And if you have other insurance, it will not pay its share until Medicare pays its share. So if you don't have Medicare, you could end up getting stuck for the whole bill. And finally, your private insurance options may be limited. If you're in poor health or you have a pre-existing condition that private insurers, they coordinate with Medicare, they have to take if you sign up for Medicare during your enrollment period. But if you don't, and then you go to apply for private insurance later, you may not be able to get that insurance, or you may be charged a higher premium. So let's back up a bit and ask, what is Medicare? Well, it's a national health insurance program for people over 65. It was signed into law in 1965 by then President Johnson. It's administered by the Centers for Medicare and Medicaid Services, and enrollment is handled through the Social Security Administration, the SSA. Everyone over 65 is eligible for Medicare. This includes all U.S. citizens and legal residents who have lived in the U.S. continuously for at least 5 years. Now, some people under 65, they can get Medicare if they receive Social Security disability benefits, but our discussion today is going to pertain to the first group, and that is the people over 65. So Medicare is actually divided in 4 parts. Part A covers the cost of hospitalizations. Part B covers part of the costs of medical services, such as doctor visits, procedures, and diagnostic tests. The bills for Part A and Part B are paid by Medicare. Parts C and D, that's where the private insurance comes in. Part C is an alternative way to get Medicare. You can sign up for a Medicare Advantage plan offered by a private insurer and get all of your services under Parts A and B, and usually the prescription drug coverage as well, through the Medicare Advantage plan. So instead of Medicare paying for your hospital and your doctor bills, it pays that insurance company offering the Medicare Advantage plan a flat payment for each enrollee, and then that plan is responsible for managing and coordinating your care. On the far right of the screen, you see Part D, and that is prescription drug coverage. It is offered by private insurers who contract with Medicare. Now, each prescription drug plan is slightly different, which is why you're going to want to shop carefully for your drug plan. Even if you don't take any prescription drugs when you first go on to Medicare, you'll want to sign up for Part D of the drug plan, because if you go without drug coverage for very long, you're going to face a penalty when you finally do enroll. So the image here shows 2 ways to have Medicare. Option 1 on the top, option 2 on the bottom. So option 1, if you go with the original Medicare on the top, you sign up for Parts A and B. Then you decide if you want the drug coverage under Part D. So this actually shows drug coverage as optional, but it can be dangerous to go without the drug coverage. So we recommend everyone, plan to have some sort of prescription drug coverage from the outset, from when you start with Medicare. And then in step 3, you decide if you want supplemental coverage. Again, Medicare shows this as optional, but we think it's pretty important because Medicare leaves too many gaps. And then the second way, so option 2, the second way to get Medicare is through a Medicare Advantage plan offered by a private insurance company. That's on the bottom of this slide. And there are many companies in this area offering Medicare Advantage plans. So if you go this route, it's going to be important to shop plans and find the one that meets your needs. And again, drug coverage shown as optional has the plus sign there, but we would recommend you choose a Medicare Advantage plan that offers prescription drug coverage. So choosing how you take Medicare is a big decision. It needs to be individualized. And certainly we can't go into much depth here today, but we can get you around certain pitfalls. And we're going to start by, how do you enroll in Medicare? Well, if you're receiving Social Security when you turn 65, so if you're receiving Social Security and you turn 65, you're going to automatically be enrolled in Part A and B. If you are working and covered by an employer plan, you may not want Part B. In that case, you can decline it. Otherwise, you'll go ahead and accept Medicare Parts A and B, and your coverage will start the first day of the month that you turn 65. Parts C and D are not automatic. So if you want a Medicare Advantage plan, you'll have to contact the insurance company offering it and sign up for Part C through them. Or if you want to stay with the original Medicare and have a standalone Part D, so you're adding the prescription drug plan, you'll need to decide which insurance company's plan that you want to go with, and then you'll have to proactively enroll there. You should do this at the same time, by the way, that you enroll in Parts A and B before your 65th birthday. What if you're not receiving Social Security when you turn 65? Well, more and more people are continuing to work, or at least delaying the start of Social Security in order to receive a higher benefit. In fact, we have a separate webinar on that available on our website at horizonfg.com under Contact Us and on the events page if you want to check out more info about Social Security. But if you are not receiving Social Security, in this case, you're going to need to proactively enroll in Medicare during a Medicare enrollment period, and there are 3 Medicare enrollment periods. The initial enrollment period applies if you are not covered by a group plan that covers 20 or more employees when you turn 65. If you are covered by a group plan because you or your spouse is still working, you have a special enrollment period, which we're going to talk about in a minute. Now, if you miss either one of those enrollment periods, you can still sign up for Medicare during what they call the general enrollment period. So 3 enrollment periods. The initial enrollment period, that is for people who aren't covered by that group plan of 20 or more employees at 65. So starts 3 months before you turn 65, and that period lasts until 3 months after you turn 65. But although it lasts, as you see here, a total of 7 months, you should plan to enroll in Medicare during that 3-month period before you turn 65. Then your Medicare coverage is going to start the first day of the month that you turn 65. And by the way, if your birthday happens to be on the first day of the month, everything's kind of moved up a month. Just pretend your birthday is in the previous month. For example, if your birthday is June 1st, well, then your initial period would start February 1st. So if you signed up in February, March, or April, your coverage would start May 1st under that scenario. Now, we've been talking about signing up for Medicare as a whole, but there are times when we need to break it into parts. And most people will sign up for everything all at once, but there may be times when you want to sign up for some parts and not others. So if you are still working when you turn 65, check with your benefits administrator to see if you should sign up for Part A. We mentioned earlier that if you're covered by an employer group plan when you turn 65, you have a special enrollment period that comes later. However, you may want to sign up for Part A when you first become eligible for it at 65. The reason is that it may offer better coverage for hospitalization than your employer group plan. And Part A is usually free to you, but check with your benefits administrator anyway on that point. Now, if your employer group plan is a high deductible health plan paired with a health savings account, that's an HSA, and if you want to keep contributing to the health savings account, you should not sign up for Part A. And the reason is that once you enroll in Medicare, your HSA contributions must stop. But let's be clear, if you have an HSA and your employer plan covers fewer than 20 employees, you will have to drop the HSA and sign up for Medicare during your initial enrollment period at 65. Well, if you are not covered by an employer group plan when you turn 65, you will want to sign up for Part B during your initial enrollment period, preferably that 3-month period before your 65th birthday. So if you're not working, or if you're self-employed, as you see here, or if you're employed by a company that has fewer than 20 employees, or if you're on COBRA receiving retiree health benefits, you'll want to sign up for Parts A and B during that initial enrollment period. Now, if you signed up for Parts A and B during the initial enrollment period, and if you think you will ever in your life want prescription drug coverage, you should enroll in Part D at the same time. If you go more than 63 days without what's called creditable prescription drug coverage, you will pay a late enrollment penalty when you finally do sign up for Part D. So, it's better just to go ahead and get your drug coverage from the outset, even if you aren't taking any prescription drugs. As mentioned before, we have two options. You can roll in that standalone prescription drug plan, that Part D, if you have original Medicare, or you can get drug coverage through a Medicare Advantage plan. Okay, that takes care of the initial enrollment period. Now we're going to talk about the special enrollment period. And this is for people who were covered by an employer group plan that covers 20 or more employees when they turn 65. In this case, you will not be penalized for not enrolling in Medicare at 65, but you will be penalized if you don't sign up during your special enrollment period. The best time to sign up is before your current coverage ends. That way you're not going to have any gaps in coverage, but you actually have a grace period of several months to avoid late enrollment penalties. So for Part B, that grace period starts the month your coverage ends and lasts for 8 months. But for Part D, it's different. It's 63 days, okay? So to summarize, you can avoid late enrollment penalties by signing up for Medicare during your initial or special enrollment period. But to avoid gaps in coverage, which is even more important, you should sign up before your current coverage comes to an end. Well, what if nobody ever told you about the Medicare enrollment periods and you didn't sign up when you were supposed to? Well, believe it or not, you can still sign up, but now you have to do it in what's called Medicare's general enrollment period. And that runs January 1st through March 31st of each year. This is the only time you can sign up for Medicare if you are outside of your initial or special enrollment period. So coverage in this case starts July 1st. So as you can see, this could leave you with some coverage gaps. So you really want to avoid having to sign up during the general enrollment period, because it could be months before that coverage kicks in. But it may be the only option for some people. And so it is important to know that you just can't sign up for Medicare as soon as you realize you failed to do so. If you're outside the general enrollment period, you're going to have to wait until the next one rolls around. Okay, let's do a quick review of the Medicare enrollment periods here. And the initial enrollment period is for everyone age 65 who is not covered by an employer group plan that covers 20 or more employees. So those would be the small plans. That's the initial enrollment period. The best time to sign up is 3 months before your 65th birthday, and Medicare coverage will start the first day of the month that you turn 65. The special enrollment period, that's the second one there, is for everyone over 65 who is covered as a current worker or a spouse of a current worker under an employer group plan that covers 20 or more employees. The best time to enroll in Medicare is before that coverage ends. And then you'll want Medicare coverage to start the first month of the enrollment. Now, the general enrollment period, the one on the bottom, is for people who did not attend this presentation and didn't need to know they even needed to sign up for Medicare during the initial or the special enrollment periods. They can sign up between January 1st and March 31st, remembering that coverage actually doesn't begin until July 31st. So those are the enrollment periods, but how do you even sign up for A and B? Well, it's actually pretty easy. So as I mentioned, if you're receiving Social Security when you turn 65, you're going to automatically be enrolled in Medicare. If not, you can go to the website here, ssa.gov, and you click on Medicare, and it will have the big Apply for Medicare Benefits button you can click on. Or you can actually call the Social Security office, 800-772-1213. And there's more information about Medicare at this website on the right side, medicare.gov / Medicare eligibility. Let's leave the slide up just for a second in case you want to jot that down. And I'm going to take a swig of water. Okay, so that's ssa.gov, 800-772-1213, or medicare.gov for more information. And now we continue on to sign up for Part D. So Part D isn't quite as straightforward because first you have to decide how you want your prescription drug coverage, whether you want the standalone prescription drug plan or the Medicare Advantage plan. So in either case, you'll be shopping for plans offered by private insurers. And once you've decided on original Medicare versus Medicare Advantage and then chosen a specific plan, you can enroll in Part D through the insurance company or through Medicare. All right, this brings us to Part 2, which is Medicare and private insurance. Now, this pie chart here kind of shows a breakdown of spending by the average Medicare beneficiary for premiums and services, and almost half of the spending, so the blue portion here, $2,294, is for insurance premiums, while the $3,166, that is spent on services, including long-term care. So total out-of-pocket spending by the average Medicare beneficiary, a little under $6,000 in this scenario, but these figures, as you can see on here, are actually from 2016, which is the latest information we have. So you can bet that's a little higher now, but let's talk about more and focus on the out-of-pocket costs paid by Medicare beneficiaries. So premiums and out-of-pocket costs, they fall into those two categories. Monthly premiums are paid to Medicare and to the private insurance companies offering drug plans and Medigap policies or those Advantage plans. So there's monthly premiums involved. Out-of-pocket costs, okay, that's going to include deductibles, a portion of the doctor bills not paid by Medicare, and then there are some services not covered by Medicare that you might have to pay out of pocket on. But let's take a look at the monthly premiums first. So good news, Part A is free if you and your spouse have paid into Medicare for over 10 years. And this is one reason most people sign up for Part A when they turn 65, even if they're covered by an employer group plan. It doesn't cost anything. So Part B is a little different in that it costs $148.50 per month for the year 2021, plus there's an income related adjustment if applicable, and we'll show you that in a bit. The Part B premium is adjusted for inflation as well, so that actually could be higher next year. And as you see, also higher income beneficiaries could pay a little more. The Part B premium is paid to Medicare. Part D premiums vary depending on which plan you choose. The Part D premium is paid to the private insurance company whose drug plan that you choose. So this table has a lot of stuff going on here, but on the left-hand side, it's basically how you file your tax, the first three columns, how you file your taxes, single, joint, or married filing separately, and what your modified adjusted gross income is. And so the rows just go down. The more you make, the more they go down. Okay, and then the middle columns are how much would your Part B monthly premium be, and then if there are any add-ons to that Part B, the next two columns are Part D, what you might pay monthly there, and any add-ons. So let's go through a scenario here. So if top row we'll look at, if you're single and your income is under 88,000, or if you're married, let's look at the next one too. If you're married and your income is under 176,000, so that's the top row, the first two filing scenarios, 88,000 and the 176, single and joint. We move over to column 4, which is the Part B premium, $148.50 per month. And the next column is there any income related adjustment? No, there isn't if that is your income. So there won't be any add-on. Part D, the premium is going to vary, but if you pick a plan that charges the average premium, it's going to be about $40 a month. So we add the 40 to the 148, and out to the right, we get total for Parts B and D at $188.50 per month when you add those two together. So if your income falls into one of these other tiers below the top row, you're going to pay an income-related adjustment on top of the base premium. Okay, let's look at an example there. If you're in that second tier, so let's take a look at the second row going across. That's the $88,001 to $111,000 filing single, and 222 up to 276 filing jointly. Medicare Part B, the 148, then I'm sorry, I looked at the wrong column. 176 to 222 there. Yeah, 148.50 is the Part B. Then you look at the 59.40, second row, and then Part D is your $40, but the income adjustment is $12.30. So you add up everything in that row, monthly premium somewhere around $260.20. So again, one more income bracket down, you're paying a little extra. And keep in mind that these are per person, by the way. So if you're a couple, you can actually double these amounts. And so it's also important that your tax return from 2 years ago is what's used to determine that income related adjustment. So for example, the adjustment for 2021, that's going to be based on the income you reported on your 2019 tax return. And so also keep in mind the premiums that's shown here, they don't include premiums for the Medicare Advantage or supplemental plans. This is just for Part B and D only. All right. Now let's talk about deductibles. So in addition to the premiums, there's going to be some other out-of-pocket costs under Medicare. So if you have to be hospitalized, the first $484 in hospital costs will come out of your own pocket before Medicare starts paying. That's the deductible for hospitalization. Some private insurance plans will cover that, as we'll see in a minute. The Part D deductible, or Part B deductible right below it. So the Part B deductible, $203, that's reasonable. And this is waived for, as you see, some of the preventative measures such as flu shots, and diabetes tests, certain things like that. The Part D deductible, that's the drug coverage, is $445 per year under the standard Medicare design, but Part D coverage is a little complicated, as we're going to see in a minute. All right, after you've met your deductibles, there are some other costs. Medicare doesn't pay your entire medical bill. So if your hospital stay actually exceeds 60 days, you're going to be responsible for $371 per day up until the 90th day. That's the copay after 60 days in that window, 61 days to 90 days, $371 per day. But after 91 days, it goes up to $742 per day. up to the 150th day of hospitalization. And if you're in the hospital after that, you're going to pay the full costs. Medicare does pay the full cost of 20 days of skilled nursing care. After that, you'll pay $185.50 per day for days 21 through 100. If you need more than 100 days of skilled nursing, that's when you would pay the full cost there as well. As for Part B, your responsibility is 20% of the Medicare approved costs. So you see assigned claims there. Doctors who accept assignment, they agree to be paid directly by Medicare and will not bill you any more than the Medicare approved amount. So doctors who don't accept assignment, they can charge more. If they don't charge more than 15% over the approved amount, Medicare is going to pay 80% of the Medicare approved amount, and you'll be responsible for the rest. That's the 20% plus anything up to the 15% over the approved. Okay, Part D coinsurance. So under the standard drug plan design, the beneficiary pays that $445 deductible, then 25% of drug costs after that deductible has been paid. And then there is a small copayment once out-of-pocket spending has reached a certain level, which is $6,550. But again, drug plans vary widely. Some will pay more, requiring you to pay less. And it's certainly going to be important for you to find a plan that covers the drugs that you actually take, for sure. So after looking at all those out-of-pocket costs, you have to be, wondering, well, gosh, what does Medicare actually cover? Well, it covers the first 60 days of hospitalization, minus that deductible, of course, and it covers 80% of your doctor bills, and it covers some of those preventative services, as we mentioned. The best reference, though, on finding out what Medicare covers is the Medicare and You booklet. And I strongly suggest you go get that. And you can do it by calling the number on the screen here. That's 800, it's kind of small, 800-633-4227, or go to medicare.gov. You can actually download a PDF version of it too, but it's called Medicare and You, and it outlines a lot of things that Medicare will cover. The Medicare and You booklet also spends, 20 pages talking about what it covers, but they only really devote one page to talking about what it doesn't cover. And I'm not talking about partial payments. I'm talking about no coverage whatsoever. So you see this list of services on the screen now. That's some of the things here that Medicare doesn't cover, but some of these you may be able to avoid. Cosmetic surgery, that's optional, for example. Medicare doesn't cover that. Any care delivered outside the US, how about that? So if you don't travel, you don't have to worry about that. But some of these other things are certainly necessary. You think about dental work and eyeglasses and hearing aids. Those are things you're going to have to cover yourself. So this is where that private insurance comes into play. Private insurance can cover all or part of your deductibles, those hospital costs after 60 days, remember the copay, and the 20% of the doctor bills that Medicare doesn't pay. And of course, all prescription drug coverage is offered through private insurers who they contract with Medicare. So Medicare alone doesn't cover them. Depending on the drug plan you choose, it may cover the deductible, and it should cover most of the cost of certain drugs during the initial benefit period and what they call the catastrophic coverage period, but it won't cover all drugs. So each plan has its own list of drugs called a formulary, and it won't cover much, if anything, in what they call the donut hole. And so for that reference, I would say I would just point you to the Medicare and You booklet on what the donut hole is for drug coverage. Medicare supplement insurance, commonly called Medigap, those policies, they are issued by private insurance companies, and they are designed to fill those gaps that Medicare doesn't cover. And although they're not affiliated with Medicare, they are bound. They do have to follow certain federal and state laws, and that's designed to protect you. So Medigap insurance policies are standardized. So, and they're identified by the letters A through N. So for instance, if you bought Plan F in California, it is going to offer the same benefits as Plan F in Louisiana or New York or wherever. However, those premiums can vary considerably from company to company and from area to area. And just as an example, you know, in one Florida county, the monthly premiums for what they call Plan F ranged between $192 to $465 per month for the exact same policy. And so that just underlines why it's so important for you to carefully evaluate Medigap insurance and not pay too much for it. And so this table here, a lot of busyness going on here, but this shows you the various benefits for all the plans, as I mentioned, A through N. You see on the left-hand side, listing out each one of the benefits in each plan. And this is also in that Medicare and You booklet, so certainly don't need to take a screenshot or anything, don't have to memorize it. The main thing to remember is that when you are looking at a particular plan, it may be the same as every other plan offered by other insurance companies. So if it's A, B, whatever, the same features will be built in there. So you want to make sure you don't overpay for the same policy if you can get it elsewhere for less. Medicare Advantage plans, which remember also called Part C, they're offered through private insurance companies that contract with Medicare. And so Medicare pays an amount to those plans for each member's care. And so then the plan is responsible for providing the care. You may have to use the network's doctors or hospitals of the Medicare Advantage plan. So you'll want the plan that includes prescription drug coverage, as we talked about, and you may even be able to get extra benefits on some of these plans, including vision care, you know, but the benefits and cost sharing for Medicare Advantage plans are different than the original Medicare. So again, you need to shop those carefully and choose a plan certainly that fits your needs. And this is just a reminder, once again, you know, shop carefully. Medigap policies are standardized, but the premiums vary very considerably. So first, choose a plan that offers the coverage you need. Plan F, by the way, is the most comprehensive plan. And then choose a reputable company offering that policy at the lowest price. And before signing up, you know, you want to check with your provider's billing department, make sure that they process billing for the company you choose. Otherwise, you may have to pay the bills yourself and then file a claim to get reimbursed through the insurance company, and that could create a headache. Drug plan benefits vary considerably. If you don't take any prescription drugs, you know, at present, you can choose the cheapest plan available, and you can always switch to a more comprehensive plan later. If you do take prescription drugs, you'll want to examine each plan's drug list, that formulary, to see what kind of coverage is provided for you and make sure it includes the medicines you take. And the same with Medicare Advantage plans. Evaluate each plan's offerings, costs, et cetera, and make a clear choice about which private insurance plan to go with. Part 3 now. So this is planning for higher healthcare costs in retirement. And we look at this, this is, you know, look at healthcare spending by gender. So we have the men on the left side and the women on the right-hand side of the screen, and by age cohorts. And so overall, you know, women do tend to spend more than men on healthcare. And older people, no surprise, spend more than younger people. A large part of these expenses certainly come later in life, and a lot of the large costs are for long-term care. So here's what a typical Medicare budget might look like today, considering just the premiums only. So Part B, we talked about earlier, $148.50 for a lot of folks. A Medigap premium, about $200, let's say. The Part D drug premium, $40. And then we total that up. So $388.50 for a monthly amount of just premiums. That includes B, D, and the Medigap. And now we consider both premiums and out-of-pocket expenses on this slide. And the typical healthy Medicare beneficiary under this scenario might spend nearly $6,000 per year in premiums, non-covered prescription drugs, and other out-of-pocket costs when you consider, dental and vision and alternative care, some of those things that, aren't covered under traditional care. And so what can cause your healthcare budget to change? We'll mention these kind of at the outset, but it's two things, really. It's inflation. That's that rising cost of goods and services. And then the possibility of getting sick, and being frail. As healthcare costs continue to rise, insurance premiums certainly go up, and non-covered services that you have to pay for yourself, they get more expensive. And if you get sick, you may need more expensive, prescription drugs and have to spend so much of that. You find yourself in that donut hole again on the prescription. Look that one up, having to pay many thousands of dollars a year for your medication. And so there's always the possibility that as you age, you'll require, some of these non-covered services, like, maybe major dental work or hearing aids or long-term care. So how can you plan for rising healthcare costs when you might be on a fixed income when you retire? Well, one way to do that certainly is to set aside enough funds to cover for future healthcare costs before you retire. Fidelity, they do a study every year to determine how much the average couple might need at the start of retirement to fund all their future healthcare costs, not including long-term care. And they say the average couple is going to need about $295,000. And so right below that, you see the Employee Benefit Research Institute. They did a similar study, and different variables. They came up with $130,000 for men and $146,000 for women. So if you add those two, $270,000 for couples, pretty close to what Fidelity came up with. But these, again, they're just the averages. So if you live longer than an average life expectancy, or if you have different healthcare needs, you might even need more than this. And so remember, these amounts don't include long-term care. So how many of you, know someone who got old and needed long-term care? We're not necessarily talking about a nursing home here, but long-term care can range from someone, coming to a home a few hours a week to help with meal preparation to even skilled nursing care. The important thing to know is that Medicare and Medigap don't cover long-term care. The most comprehensive Medigap policy will pay for 100 days of skilled nursing care only. But if you're not sick enough for skilled nursing care, they're not going to pay for it. The average period of skilled nursing care is about 28 days. And when it comes to custodial care for help with activities of daily living, there's no coverage at all. Although home health may help a little bit in some of those situations. But before you say, I'll never get old and need help, consider this, that 35% of people over 65 have some sort of activity limitation. So some of them need help with so-called instrumental activities of daily living, which includes things like, shopping and cooking. Others need help with, bathing and dressing, things of that nature. And here we see kind of the causes of those activity limitations for people over 65. And more than half of the population suffers from hypertension. And nearly that many also, where you see on the far right, arthritis. And those numbers don't take into a wide, account, a wide age range. So we know that these conditions, usually get much worse kind of the older you get, So when you're healthy and active in your 60s, let's say, it's hard to imagine not being able to bathe or dress yourself. But it's just a fact of life that, people need help as they get older. Nearly half, of all people over 65, as we look at this, have some difficulty walking even. And this in itself can limit the things certainly you can do for yourself. So for most people, the need for long-term care is kind of very gradual. You'll start out needing help with maybe shopping and preparing meals, and it's kind of that level one assistance, managing money and helping with travel maybe. And some of these things are certainly provided by a family member, or maybe it's a paid housekeeper or something of that nature. And then you get to where you have difficulty with these essential, activities of daily living, the eating, bathing, dressing, going to the bathroom, transferring from the chair to the bed and maintaining continence. I know nobody likes to think about these things, but we all know people who certainly have needed custodial care. And then the third level of care is skilled nursing care. And this is care provided by a licensed nurse for a medical condition, or in some cases, rehabilitation. Sometimes this level of care is short-term. And if you need it for 100 days or less, Medicare and Medigap might pay for it, depending on which Medigap policy you have. But sometimes skilled nursing care is needed for a longer period of time, and then the costs can really become burdensome. So how much does long-term care cost? It does vary on the type of care. And so this is from Genworth, the Genworth Annual Cost of Care Survey. And it shows us the median costs kind of across the United States. So homemaker services, there you see, cost about $147 per day. Home health, this will be a private home health aid service, about $150 per day. Adult daycare, $74. However, that can range. We've seen that from $30 all the way up to $160. Residents in an assisted living, pretty big range here, $3,000 to $7,000 per month, kind of depending on the location and the amenities that are included. The median monthly rate, by the way, for assisted living is about $4,300 per month. The most expensive type care, though, as you see, is in a nursing home where residents can get skilled nursing care. And a private room there ranges kind of in the $200 per day to way up there to the $1,200 per day. The median, those is $290 as outlined here. So you take that $290 1 year at that rate, and you're talking, $100 grand easily. None of us want to think about getting old, and needing long-term care, but there are some very compelling reasons why we need to. One is to spare your kids or other family members the burden of taking care of you. And, they may not mind shopping or paying your bills, but if you're in need constant supervision or help with bathing and dressing, that could become beyond the call of duty for even, the most devoted son or daughter. And certainly another reason to plan for long-term care is to avoid having to spend down assets in order to qualify for Medicaid. Medicaid is the state-run welfare program. It's going to pay for your care if you don't have any money, but that's the point. You have to spend down the assets to less than $2,000 in order to qualify, essentially, leaving you destitute. So people on Medicaid, they don't have a lot of choices about the kind of care they receive. And this is another reason to plan for your own long-term care, to be able to direct your own care and obtain the kind and quality of care you want. And when you're paying for it out of funds that you kind of set aside for that purpose, or when you have insurance that is paying for it, you can decide how you'll be cared for, whether it's in your own home or maybe in an assisted living facility of your choosing. So there's a lot more to say about planning for long-term care, but our time that we devoted today is nearly up. So we're going to talk about those 3 reminders that relate back to the 3 key points that we talked about at the beginning of the presentation. So reminder 1 is to enroll in Medicare on time. Know which of those enrollment periods applies to you, whether you need to sign up at 65 or can you wait until your employer group coverage ends and enroll when you need to in order to avoid those penalties and coverage gaps. Reminder number 2 is to shop carefully for private insurance to go with Medicare. Evaluate all your options choosing your drug plan, Medigap policy, or the Medicare Advantage plan that offers the coverage you need at the price you can afford. And don't be one of those people who pay too much for private insurance because they didn't know any better. And finally, plan now for higher healthcare costs in retirement. We know healthcare expenses will be higher than they are today. So when you're planning your retirement and figuring out how much savings you'll need to make your money last, be sure to factor in an extra amount for healthcare. We believe you're going to be glad you did. So that's going to wrap things up for today's presentation, and we certainly appreciate you taking out time of your schedule to be with us. If you look in the chat section of the Zoom meeting right now, we have added an attachment. It's a 4-page document. It's called a Guide to Medicare Planning, and it does a great job of summarizing the material we presented here today. So feel free, if you want to download a copy of that now in its PDF format, certainly welcome to do that. Or if you would like for us to send you the printed version, we have those available. Just simply send us a message with your address. Just email us at info@horizonfg.com, and we'll mail one right out to you. How about that? Also, if you have any questions about anything you heard here today, please send those to our email address, info@horizonfg.com. We'll have one of our Horizon advisors reach out to you with any answers that you're seeking there. We're going to leave the meeting up for a few more minutes to get you a chance to download that copy. Also, you will see, we mentioned it earlier, the Medicare and You handbook. That is available at Medicare, www.medicare.gov. I suggest you take a look at that. They can send you a physical copy as well, or you can download that. All right, we're going to leave the meeting up a few more minutes. Hope to see you at the end of October for our next webinar, which we're going to be announcing in the next week or so. Until then, so long, and thanks for joining us. We'll see you next time.